What's up, folks? RDJ here, coming to talk to you about addiction. I'm not going to go into great detail. Just going to go into it just a little bit, give you some basic information. Feel free to follow me on any of these social media platforms that you see. Leave a comment. Give me any questions. Tell me any topics that you might want to talk about. Be happy to do it. Anything related to addiction, anything related to mental health, anything related to Christian counseling. Be there for you and help you with some of it. Let's talk about a few numbers. Here in the United States, the best estimates are that we have at least 46 million people 12 years old or older that meet the DSM-5 criteria for a substance use disorder. Basically, it tells you we have at least 46 million people that are addicted to drugs. Out of that 46 million, only 6% seek treatment every year. And a large number of those are mandated clients. They're forced to go there through the court system because of work, trying to keep their job, trying to keep their marriage together, trying to keep their driver's license. Mandated clients. Every year in America, we have at least 96,700 overdoses. And since 2017, we are now approaching 1 million overdose deaths because of these drugs. We're not talking about alcohol. Alcohol's a whole nother issue, okay, as far as deaths go and all those numbers. It's a horrible drug, okay? The United States of America, with its 46 million addicts and those that just try to casually use these drugs, we consume 60% of all the illicit drugs in the world. 60% of all the illicit drugs in the entire world. Globally, addiction is the number 6 cause of disease, and it's responsible for between 10 and 11% of all deaths throughout the world. The etiology of addiction. I lost some of you right there, right? We'll talk about what causes addiction. What makes you become addicted when you try something, okay? Genetics, we all know that. Anywhere from 10 to 50%. I'd say it's a little bit more than that. Going to be at least in the 40-50% range, probably even higher. I see people every day that come from generations of addicts. Let's talk about epigenetics. And all that means is the environment you're raised in. Poverty, around crime, maybe you're in a dysfunctional family, systemic racism, all kinds of things just contribute to that part of it. Now, the whole nature versus nurture conversation has been going on for ages. The best thing I could tell you is that it's a combination of both. They both contribute to it, along with some other factors. The brain's reward system. When you use drugs, it hits all the areas of the brain that are focused on reward. Releases all those great neurotransmitters that make the brain just go, wow, I want more. And because of that, the brain's going to keep wanting it. Now, when this occurs over time, neuroplasticity takes effect. That means your brain adapts to it. It actually can create shortcuts that make you crave. It could be a smell, it could be a sight, it could be anything. Okay, the people you hang around with. You can walk by a liquor store and see a bottle of Jack Daniels in the window, and you've been sober for 15 years, and all of a sudden, that brain says, hey, I want that. Go get it. It's hard to quit when that happens. You have to break those shortcuts and create new ones that are more adaptive. But we'll get into that much later on. Adverse childhood experiences greatly contribute to addiction. It could be rape, molestation, abuse, a multitude of things. If you had trauma or a really bad childhood, it makes you more susceptible to becoming an addict. Violence and trauma throughout your lifetime increases your chances of addiction. If you have a mental illness, you are far more likely to be addicted. I want to talk about that. Dual diagnosis. When you have a mental illness and a substance use disorder. 61 to 88% of people that have a co-occurring mental health disorder also have a substance use disorder. I would say that it's definitely on that higher end of the scale, depending on where you're out at and what population group you work with. It could be even greater than that. At least 80 to 90% of all those that I care for have a co-occurring mental health disorder. Those that have these dual diagnoses, 60 to 100 times more likely to kill themselves. You're at a 300% increased risk of AIDS, 170% greater risk of getting Hep B, and 250% more likely to get Hep C. And individuals with a mental illness are 270% more likely to be diagnosed with a substance use disorder. So I want you to take a few minutes and kind of look over this, play it back. Think about it and let me know what you think. Let me know what you would like to see from here on out. More than happy to answer any questions. If you have a loved one with an addiction or you suffer from addiction, hit me up. I'll get you help. If you are struggling with mental illness, let me know. More than happy to help. There's hotlines for you. Mental illness, addiction, you can just call 988 and someone will get on that line with you and find you help no matter where you're at in the United States. Thanks for watching. God bless you, and I look forward to hearing from you.